Hello everyone, so in this video we're just going to talk about nebulized medication. So for this you will either need a nebulizer machine or a oxygen cylinder, which we'll go through at the end. Nebulizer machines are just essentially an air compressor with a filter, so they aren't really that complicated. They just plug in and they have a filter which sucks the air in, they have a tube where the air comes out, and they just have an on and off switch. They're a bit noisy. Not fun, and when you've got several of them going in a bay in a ward, it's a bit noisy. But I don't know, maybe someone invent a quiet one. Maybe.
Hopefully.
Yes. If we're going to give a medication to a patient, we need to do all the things that we did in the inhaled medication video. So we need to, if it's prescribed, we need to check the prescription in the same way. So name of drug, dose, route. It's been signed and dated, and you can read it properly. And then we also need to then collect our drug, which is, for this one we're going to use saline nebulizer. And so what you need to do then is obviously check the name of the drug, saline, the dose of the drug, dosage strength, so 0.9% saline, and it's 2.5 mils. We need to make sure that it's for inhaled medication, so that's an important step. And it sort of highlights that step in this, because obviously saline can come for IV use or subcut use, and this is specifically for inhaled use. And then it has an expiry date on the back. So if we're happy, we've got our patient, we've identified them correctly, we've introduced ourselves, we've checked the prescription, we've checked the drug, we can then start to construct our equipment. So we are going to collect a nebulizer mask and equipment. They come in one big pack. This one has a specific tubing that is clear, this tubing, but inside it, you will notice if you look at it very carefully, there's like a little star.
A little star. And
that star offers some reinforcement down the tube, because what you're going to do is push air into it, and that's going to be resisted at the other end, so it can warm up and become malleable, and it can also sort of expand under that pressure. So because of the reinforcement, that won't happen, and it won't keep popping off the end of the nebulizer. So this is the tubing that you need. Sounds a bit silly that we need specific tubing, but this is the tubing. And then what we have here is our nebulizer canister. Inside here, it's basically got a lid that you can take off, and then inside it, it's got this special little thing inside it which will cause the drug to be, the air to be forced through the drug to cause it to go into a vapour. So that goes in there, and the lid then goes on top. You've also got a mask inside this one. Now, some nebulizers come with mouthpieces, because if you've got someone who's a bit short of breath and you put a mask over, they might feel a bit short of breath, they might feel a bit claustrophobic. But some come with masks. This is a universal mask, so this is exactly the same mask that comes in with the that you can use with the Venturi valves in the oxygenation video. So we need to get this tube into here. Our nebulizer is all set up ready, and what you can do is now we need to get the drug into the chamber. So if you want, you can take the lid off and put the drug into this chamber. That's the proper way that you should do it. Some people will maybe squirt it directly through the mask, because essentially it's just a hole into this chamber, but it's best to take the lid off. Bear in mind that it's not sealed, so if you turn it upside down, the drug will leak out of the mask, so you've got to keep it upright now. So now what we want to do is place this mask on the patient's face. Now this is this special kind of mask, or this newish kind of mask, so the strap has to go below the ears, so it doesn't make the patient's ears sore. So my patient's pretty mobile, Gemma, and so she'll be able to put that on herself. Once it's on, she will then be able, so what I'll do is I'll turn the nebulizer on, and hopefully you'll be able to see some puffs of air coming out, puffs of vapor coming out. Yay! There you go. So she's going to feel really, sort of, her airways are all going to open up, and she's going to feel so much better now. Do you feel like a spa treatment?
I was going to say, I feel like I'm having a mini spa.
And realising you probably can't hear us because of this noise. Back in the lockdown.
I was quite enjoying my spa treatment.
Really good pause.
Mini facial.
Actually, could you hold that
Oh,
for
of course
me?
I can.
So, if your patient requires oxygen therapy, they might be having it via some nasal specs, which is absolutely fine, and you can just leave those nasal specs on, and they can go through at the rate that they were, and you can put the mask over the top of them. However, if they're having the oxygen therapy via a oxygen mask, you will need to then drive the nebulizer with oxygen. The only issue you have with that is that you have to give a minimum amount of oxygen, a minimum amount of litres per minute, through the nebuliser to create the vapour, which is 6 litres per minute. But if you turn it up too high, then that can be too much pressure for the nebuliser. So you can only really turn up to 8 litres per minute, and then if it's too much pressure, the tube will pop off. So if your patient is receiving 15 litres per minute, then you might need to really think carefully about how you're going to get the nebuliser into the patient, yet keep giving them lots of oxygen. And we can discuss that when you come and see us. So if we are going to be doing that, we want to take our tubing off there and turn this up to whatever litres per minute you need to do. And you can see, hopefully, there is some vapour coming out of there to give to the patient. Alright, so that's nebulisers. Anything else at the bottom?
Don't think so.
No. It takes about 5 to 10 minutes to finish, and it's always worth telling your patient that fact so they don't become bored or disillusioned the fact that they've been sitting there for longer than 3 minutes and is it ever going to end? Alright, thank you very much.